Hi, I'm Dr. Surtaz Sibia from the Sibia Eye Institute. Today we're going to talk about cataracts. So what is a cataract? A cataract is the natural lens of your eye that becomes cloudy over time. It's the natural crystalline lens that you're born with, and usually in our late 50s, early 60s it starts to become a cataract, and then when we get into our 60s and 70s it becomes mature enough where it affects your eyesight and vision, and when it affects your eyesight and vision we take it out with a procedure called cataract surgery. So what are the symptoms of a cataract? Typically, our patients will complain of their vision being blurry, not being able to see the street signs, having to get closer to the license plates or the bumper stickers to see them, difficulties with driving in the rain, driving at night, difficulties with glare. Some of our patients tell us that they're seeing starbursts when they see oncoming headlights coming at them at nighttime driving. Another issue patients will tell us about is that they're having difficulty discerning their blacks and blues. Their colors are not as bright as they used to be. When they look at whites, they're not so white anymore. They're more of a yellowish tint or a haze. It's amazing how many patients will tell us after they've had their cataract removed that I thought my walls were beige, but they're really white. And that's because the cataract becomes yellow-brown in color over time. And because it happens so slowly, you don't notice it. So once you've come in and been seen at our office and we decide that you need cataract surgery, we then discuss with you the two different ways of doing surgery. There's the old-fashioned way where you do everything by hand and by metal blades versus using newest technology, laser cataract surgery. What's the difference? The traditional way where we do surgery by hand, we use metal blades to make our incisions. We then take the cataract out using a special technique called phacoemulsification and then put a new lens in the eye. With laser cataract surgery, it is a newer, advanced, and safer way of doing cataract surgery. The laser makes the incisions for us. The incisions are more precise. If you try to make 100 circles freehand, you can't make 100 circles perfectly the same every time. However, the laser can. This adds stability and predictability and produces better results. Laser also make more pristine incisions that heal up quicker and faster, giving us several benefits. One benefit is that our healing is much faster and recovery is much faster using the laser. We also have less chance of an infection because the incisions heal up faster. When we use a laser for cataract surgery, we're also using less energy inside the eye. Less energy inside your eye means less manipulation inside your eye and less chance of causing surgical complications, and thus giving us a safer way of doing cataract surgery. So let's talk about cataract surgery. I've got a model eye here. The cornea is the clear window to the eye. Behind the cornea is the iris, the colored part, and behind the iris is the natural lens of the eye. The natural lens of the eye is what becomes dirty and cloudy and becomes a cataract. We're going to remove that during cataract surgery, and we're going to replace it with a clear implant lens. How is that done? We make a tiny little incision, insert a little probe, break up the cataract, we'll remove it, and then we'll replace it with a new clear implant lens that looks like this. That will go in place of the old cataract, which will then help focus to the back of the eye. So when it is time for your cataract surgery, please talk to us about what lens options you have. There are approximately a dozen different types of lenses available, and depending on your lifestyle and your requirements, we can then match up those requirements to the different types of lenses that are out there. Prior to discussing these lens options with you, we will bring you in for a set of measurements that measure the length of your eye, the curvature of your cornea, and then we'll show you the different options that are available. We have some lenses that will give you great distance vision, and you put glasses on for the computer and for the near work. We have some lenses that will give you great distance vision, as well as that intermediate range, which we call computer range, and you put glasses on for near. And we also have lenses that will give you most of your ranges of vision, like distance, intermediate, and near vision, and like your reading vision. But you might need a pair of glasses for very small print, like micro print, like medicine bottle print, reading in poor lighting conditions, maybe a condition where you may have to put a pair of glasses on, or take out your cell phone and turn on the flashlight so that you can read the fine print or read a menu in the dark with some of these lenses. If you're having any of these symptoms of a cataract or feel like you have a cataract, please visit us at Sibia Eye Institute. We have several locations in Palm Beach County. We'd love to see you here and look forward to taking good care of you.